For many years, the treatment of BPH has been, there's either medical treatment or surgical treatment, and a lot of guys just get frustrated. There's 3 different types of medicines that can treat BPH. There's the tamsulosin group, the alpha blockers that open the bladder neck, and they work, but they have side effects. There's the finasteride group that shrink the prostate, but they also have sexual side effects. And then Cialis is a relative newcomer, and it also can relax some of the muscles in the prostate, can help you urinate, but you're taking a pill all the time, and with every one of these pills comes side effect. And so people look for surgical options, something where they don't have to take a pill every single day. And the gold standard of treatment is called a TURP, or a transurethral resection of the prostate. But in doing TURPs, men are left with retrograde ejaculation quite often, where sex isn't quite the same. It can affect their sex life. It's a little bit bigger surgery. So we've tried minimally invasive surgeries with urolifts and microwaves and steam treatments. So a whole bunch of other treatments. Aquablation came out because these minimally invasive treatments don't seem to last as long as we want them to. And the resective ones, like a TURP or a HOLEP or a robotic prostatectomy, they last, but they cause side effects. And so aquablation is kind of the middle ground where you get the benefit of resecting, but you're not using as much heat or as much energy, so you don't have the side effects. You know what 3D printing is. So in a 3D printer, you make a 3-dimensional object. Well, aquablation is like a 3D resector. You put an ultrasound in the rectum while the patient's asleep, and you map out the prostate, and then you map out the exact area that you want to resect, and a robotic arm uses a saline jet to precisely resect out this map that you made. You can sculpt it. You create exactly the opening that you want to. About a year ago, there was a study that compared aquablation to transurethral resection of the prostate. And in every category they looked at, aquablation performed better. So there were better symptoms at 5 years, there were fewer complications, less need to have repeat treatment or repeat surgeries, had better flow rates, less urine in the bladder. In every category it performed better. So the benefits of aquablation are that you get all the benefits of the resective procedures, but there's no risk of erectile dysfunction. 90% of men have normal ejaculatory function, and there's no risk of incontinence in all the studies that we've done. So for a patient who wants to have aquablation, I always tell them, and I may overestimate it, but I tell them that I'm probably not going to be their friend the first week. They're asleep when it's done. They don't feel anything. They wake up with a catheter. About half the patients go home the same day with that catheter. We'll get the catheter out the following Monday morning. Now, your bladder's been pushing against this tight obstruction for years, and all of a sudden there's this 2-inch wide opening where the prostate was that the urine can come out. So there's a lot of urgency and frequency. But the bladder's smart and it calms down relatively quickly. So I may oversell that it's bad and they're not going to like me the first week, but I also see them at 3 weeks. And by 3 weeks, the vast majority of patients are very, very happy with the outcomes. And then it continues to heal. By 3 months, it's completely healed. I was very excited when I came to Utah to get aquablation up and running. So now there are 2 aquablation machines in Utah, one at Mountain Point and one at Timpanogos. The one that I've been using is the one at Timpanogos, which is the Hydros, which is the new model, which is their 2nd generation that uses AI to help create that map that we use to resect.